I'm Parm. I'm an orthopedic surgeon, and I'm going to tell you about Valentine's Day 2018. The story began about 10 days earlier. On a Sunday afternoon, had a slight sore throat, didn't think too much of it. Tuesday was my normal operating day in the NHS, so I was operating all day. My colleague had just finished operating in the theatre next door, and he had popped in to say hello. I wouldn't normally do this, but I wasn't feeling right, and I remember I asked him to scrub in and just give me a hand just finishing up. The next morning, my wife had gone off to work. I had young children. A 5-year-old had gone off to school, 2.5-year-old twins that had gone off to play with the nanny. And my wife had rung probably just after 9 in the morning just to see how I was doing. At that point, I was in the bathroom, but I could barely stand, at which point she said, "Right, I'm calling you a cab." My wife's a consultant rheumatologist and had rushed me into the A&E department. And before I knew it, I was in the resuscitation room. I had lines being put into my neck, into my arms. The only thing that came to mind was that I'd had a little bit of discomfort in my left leg the night before. They CT scanned me from head to toe. They couldn't find anything else wrong with me. And the professor of plastic surgery at the time that was looking at me was confident. He told me straight that he had dealt with lots of these cases, and he was 100% sure that this was necrotizing fasciitis. It's quite a severe soft tissue infection that spreads very quickly and can result in a septic shock with quick deterioration and a 25 to 35% mortality. The treatment is usually emergency debridement of all soft tissues that are involved, and sometimes amputation to save life. So within a few hours of having been at home, I was being consented for possibly having my left leg amputated. There's not a lot you can say at that point, but you put your trust in the people looking after you. The next memory is about 6 days later. My wife was next to me, I remember, but I was having quite severe hallucinations. I would feel like I was falling. And my wife was there, and I remember I'd grip her hand tightly. But for a few minutes, I would be absolutely terrified. The next morning was February the 14th. And it was only then where I had developed already an early beard and thick stubble that I realized that several days had passed. And it turned out that I'd been to theatre 4 times already. I had vacuum dressings on my legs, and in walks this chap. And he was subtly saying to me, "Do you know what day it is?" It's February the 14th, trying to hint to me that it was Valentine's Day and I should be looking at my wife with love because she had sat there by my bedside. He said to me, "You're going to be fine. And the reason you're going to be fine is because you're a colleague." And on his phone, he had a photograph of his 2 children. And he said to me, "The other reason you're going to be fine is because I'm a dad, like you, and it's my job to make you better." I spent 2 weeks in intensive care. And it was when I moved on to the wards that I first met Ibby Eunice, who was very conscious of what level of function I needed to achieve to get back to the person I was before. My fear partly was not just the cosmetic appearance, but what was the function going to be like. And I stand to operate. I don't sit down when I operate. And I've got to be able to balance on one leg at times when I'm operating, because I often have a patient's leg balanced on my leg. And I was concerned whether I would ever get back to being able to operate. And so when Ibby first started speaking about dermal matrices, I had no idea about them. I just had to put my trust in him, as I had done in all the doctors that had looked after me at the time. He seemed convinced it was the gold standard, and if that was the gold standard, then that's what I wanted. And it took time. It took time to get the soft tissues right and healed and granulating sufficiently that he could use the dermal matrix. And all in all, there were 20 trips to theatre, a few months in hospital to get me to where I'm now, which is back to work as a surgeon, both in the NHS and private, as a father and a husband, with very little functional compromise. If you didn't know my story, you wouldn't even know that I had a problem with my leg at some stage. You can't see it. I sort of like to think it hasn't changed me a huge amount, because, you know, I feel I was always a fairly conscientious and caring, you know, medical professional. But I suspect it has. From the stages where I was rehabilitating on the ward, trying to use crutches and struggling, you know, I would think, well, how are the patients that I expect to be able to get up straight away and mobilize and use crutches? I assume that they can do it without difficulty, yet here I am struggling to do it. It gives me a great appreciation of everyone, from the porters through to the nursing staff and the intensive care nursing staff. I really didn't appreciate until my time in intensive care. The faith you put in that one person, and then the fear that I had that the next person that was going to come on for the next shift wouldn't be as good, and they'd surprise me at just how good they were, was just phenomenal. And there was a time where I would have said, you know what, one day I'll probably pack in the NHS, go full-time private, but I love the NHS.